My name is Tom DiSalvo. I have the privilege of directing the Heart and Vascular Integrated Center of Clinical Excellence here at MUSC. To provide the safest possible care during COVID-19, MUSC has undertaken special precautions to protect patients, care team members, and families. I'd like to highlight 7 important precautions. First, MUSC immediately developed an emergency preparedness plan for COVID-19. Our planning process included our most experienced senior administrators, physician experts, nurses, and engineers. We're fortunate at MUSC to have national leaders in infectious disease and patient safety. These experts have guided us every step of the way. As a state-supported academic medical center, South Carolina expects us to show the way to all. Fully prepared, MUSC has lived up to that expectation. Second, as part of our COVID-19 hospital bed surge plan, MUSC opened new COVID-19 cohort hospital units. These COVID-19 cohort units, located in access-restricted areas of our hospital, have specialized airflow, staff training, and equipment. These cohort units isolate COVID-19 patients immediately, reducing the risk to all other patients. Third, MUSC established a COVID-19 virtual care clinic with telephone and online access. This telemedicine clinic, free to all South Carolina residents, screens for COVID-19 symptoms. The virtual care clinic recommends testing for all who require it. In a week, MUSC built a drive-through testing facility in West Ashley at the Citadel Mall site, where over 200 patients per day can have a swab taken without leaving their cars. Safe, efficient, and convenient. Fourth, MUSC created, in just 3 short weeks, an in-house laboratory to perform COVID-19 testing. MUSC is the only hospital in South Carolina with the ability to perform on-site COVID-19 testing. MUSC tests more patients and gets test results quicker than any other hospital. Our laboratory runs up to 500 tests per day with a test result turnaround time of less than 24 hours. This unique ability allows us to quickly diagnose and isolate COVID-19 infected patients or staff. It is a critical part of preventing the spread of COVID-19 infections at MUSC and in our Charleston community. Fifth, MUSC pivoted immediately to telemedicine clinic visits. Prior to COVID-19, MUSC was already a national leader in telemedicine. Expanding rapidly, telemedicine visits now make up over 80% of our clinic visits. Across MUSC, we perform thousands of telemedicine visits daily. Our patients all over South Carolina embrace the continued contact with their providers. Sixth, we revised surgery and procedure practices. We reserve special operating and procedure rooms for COVID-19 patients and disinfect the rooms and instruments completely between each case. We perform COVID-19 testing in our patients before surgeries and many procedures. Our surgeons, procedural physicians, and nurses are all tested for immunity to COVID-19. All our staff monitor themselves twice daily by taking their temperature and will immediately self-isolate with any temperature over 100 degrees or any respiratory symptoms. Our staff are not allowed to return to work until they test negative for COVID-19. Seventh, we adopted strict and comprehensive safety measures in all our outpatient clinics and testing sites, including screening all patients and visitors for symptoms prior to entering any of our facilities, separating all patients with respiratory symptoms from all other patients, providing registration services and waiting for appointment in one's own car, having all our care team members and patients wear masks whenever they are in our facilities, redesigning registration and waiting areas to ensure personal social distancing of at least 6 feet, restricting visitors to our facilities, following strict hand washing practices and providing hand sanitizer in all our facilities, especially cleaning contact surfaces, reusable supplies and equipment after each use with disinfectants. Taken together, we believe that these measures will markedly reduce the COVID-19 infection and spread to our patients and staff here at MUSC. We are doing everything possible to prevent you from getting a COVID-19 infection at MUSC. It is our obligation, our vow as your physicians, nurses, and care team members to do so.